Let us talk about altered surgical anatomy. Here, a case of distal gastrectomy with the Roux and Y gastrojejunostomy. Here is the anatomy, and I want you to see there are multiple areas of anastomosis and closure of different limbs. When you know that you're going to do an ERCP in a patient who had surgery, it is important to find out the type of surgery. Is this Billroth 1, Billroth 2, or distal gastrectomy with the Roux and Y anastomosis? So those three things are very important. In addition, you also want to check the surgical report to figure out the length of the afferent limb, and that will help you figure out whether you could reach the ampulla using the peroral route for ERCP. So let us learn about how these anastomoses are created. Here is a normal anatomy, and this is the area of the stomach resection completed. And then you mark the jejunum for sectioning, and once the jejunum is sectioned, you do a gastrojejunostomy. Here it is completed, and then perform a jejunal anastomosis or jejunostomy. As you can see here, in Roux and Y anastomosis, there is a gastrojejunostomy, closure of this limb, jejunal anastomosis, closure of this limb. And let us see how do you perform an ERCP in a patient with distal gastrectomy and Roux and Y anastomosis. So endoscope going down the esophagus, stomach, first anastomosis, second anastomosis, afferent limb to the ampulla. It's a long circuitous route, and these procedures are technically challenging. So it's important to allot a decent amount of time when performing these cases where there is altered surgical anatomy. And with cannulation and injection, you can create a cholangiogram. When you see somebody with a long limb, a long afferent limb, and you are not able to reach that site, options include asking an interventional radiologist to do a cholangiogram by the percutaneous route. And nowadays, ultrasound experts, interventional endoscopic ultrasound experts, are also able to reach from the stomach into the liver and access the bile duct to manage these problems. I hope this anatomy is useful. Thank you.